Hi all, my name's Jasper. I'm a student exercise physiologist from Adelaide Uni. In this presentation, I'm going to talk to you about the role of exercise in chronic heart failure. We'll talk about some of the safety considerations, exercise prescription guidelines, and just the role of the accredited exercise physiologist in its management. So chronic heart failure occurs when the heart cannot pump enough blood to meet the body's needs, which can lead to symptoms such as fatigue, breathlessness, and reduced exercise tolerance. Heart failure can typically be classified as heart failure with reduced ejection fraction, and this is where the heart has reduced contractile function, or it can be classified as heart failure with preserved ejection fraction, which is where the heart becomes a bit stiff and can't fill up effectively. Although the mechanisms differ, both forms reduce functional capacity and quality of life. Now, the ESSA position statement encourages structured exercise training as a safe and effective component of management for individuals with stable chronic heart failure. Exercise training provides important physiological and functional benefits for individuals with chronic heart failure. The ESSA position statement highlights that exercise can improve peak oxygen uptake, exercise tolerance, and overall just quality of life. These improvements allow patients to perform daily activities with a lot more ease. Exercise also improves skeletal muscle function and oxygen utilization, which can help compensate for the reduced cardiac output. Importantly, research shows that exercise-based rehabilitation programs can help reduce hospitalization rates for chronic heart failure. Because of these immense benefits, exercise is considered a key component of multidisciplinary heart failure management. Now, I'd like to bring your attention to a graph I'm showing from a 2009 study. Now, this graph shows cardiac event-free survival over 24 months in people with chronic heart failure. And this is based on how much their exercise capacity has improved during their training. So patients whose peak oxygen uptake improved by more than 6% had fewer cardiovascular events and better outcomes compared to those who showed little improvement. This can be seen with the green dotted line being those who had great improvement, and the orange line for those who didn't improve their oxygen uptake. In simple terms, greater improvements in aerobic fitness were associated with better long-term heart health. Although we have now established that exercise is beneficial for chronic heart failure, appropriate screening and monitoring is still essential. The European Society of Cardiology states that patients with unstable cardiac conditions should not exercise until medically stabilized. This includes anything that is under the absolute contraindications seen in the table provided on the right. During exercise, clinicians should monitor for adverse symptoms such as chest pain, dizziness, abnormal breathlessness, and changes in blood pressure. Accredited exercise physiologists monitor physiological responses during these sessions, and functional tests such as the PrEP test are also used to assess baseline capacity and monitor the improvements of the client over time.
Now let's talk about the exercise recommendations for chronic heart failure patients. AEPs should follow the New York Heart Association heart failure classifications to help with the prescription of loading for their client. Aerobic exercise is typically recommended 4 to 7 days per week at low to moderate intensity, with progressive resistance training 2 to 3 days per week to help improve muscular strength and functional capacity, along with some flexibility 2 to 3 days per week. Exercise programs really do need to be individualized to the client, as factors such as heart failure severity, comorbidities, and whether the patient has HEF or HFrEF should influence exercise intensity and progressions. Accredited exercise physiologists are also really great at facilitating behavior change through education. They can also help with goal setting and supervision to help promote long-term exercise adherence. So where does an exercise physiologist fit into all of this? So we play an important role in the management of chronic heart failure. We conduct assessments of functional capacity, symptoms, and cardiovascular risk before prescribing exercise, and we design safe, individualized programs tailored to the patient's conditions and needs. We also monitor physiological responses during exercise to ensure safety and appropriate progression. So by working alongside GPs, cardiologists, and other allied health professionals, AEPs help improve functional capacity, support long-term physical activity, and optimize outcomes for individuals living with chronic heart failure. Now, to summarize this, AEPs design safe, tailored exercise programs based on the patient's heart failure type, severity, symptoms, and functional capacity. AEPs monitor physiological responses such as heart rate, blood pressure, and symptoms during exercise to ensure that participation is safe and that there is appropriate progression. Exercise programs delivered by AEPs can improve functional capacity, quality of life, and support long-term physical activity in people living with chronic heart failure. Here's the references used for this presentation. I thank you for listening and hope you consider referring your client to an AEP for chronic heart failure.